Hi class, my name is Barbara Walwork and I really enjoyed this week's module about learning activities. I feel like I learned a lot more than I felt comfortable with last week with Bloom's taxonomy. I think the most important thing that I learned out of this week was the importance of physical presence, and I'm trying really hard right now to implement some of the tips that Nancy Hofeck gave during her video, but I'm finding it pretty challenging, so I'm going to keep working at it. My educational project is titled Management of Dental Fear for the Dental Professionals, and I'm pretty excited about this. I'm learning a lot. I thought I kind of already knew about this topic. I've been in several situations having to deal with this, but now that I'm researching it, I'm finding out that maybe I didn't use the best techniques. So I'm very excited to be able to share those techniques that I'm learning with others, including you. The learning activities that I'm going to use in my presentation include lecture, interactive lecture, and case study. For the lecture component, I'm again going back into the physical presence. I'm going to really try to emphasize that part as far as selective use of body language, eye contact, tone of voice, things like that are so important when dealing with a patient who has dental fear and trying to get a successful treatment out of the appointment time that you have with them. In the interactive lecture portion, we're going to take a break from the lecture portion and try role playing. So we're going to pair up, and each of the students will have equal chance to play the fearful patient as well as the dental professional receiving the communication from the fearful patient. I feel like this is a great way to practice something that is otherwise maybe a little unnatural or difficult to process. So I feel like role-playing helps conquer unfamiliar territory in the sense that if you practice enough and role-play enough, eventually your responses will come out genuine, and that's all from practicing. The case study portion of my presentation also ties into the interactive lecture activity, learning activity, and I feel like this really sets the framework for a realistic situation. And again, going back to role playing, I feel like if the students are given a case scenario that is realistic, then they can actively have the role play in a sense that they are experiencing a real life situation, so that when they get into their offices and they are confronted with a fearful patient, that they'll be able to respond and feel confident about their responses. So I'm really looking forward to delivering my presentation to the class, and I also look forward to seeing what all of you have to contribute so that I can learn more as well. Thank you.